The crystalline lens is a transparent, biconvex, and a vascular structure lying directly behind the iris and pupil and anterior to the vitreous body. It sits within the lenticular fossa of the vitreous face. It contributes nearly 15 diopters to the eye's refractive power and changes shape to accommodate near and distant vision. The anterior surface is less curved with a 10 mm radius, while the posterior surface is more convex with a 6 mm radius. The equator is only 0.5 millimeters away from the ciliary body. Its tilted position gives rise to lenticular astigmatism, being more anterior superior nasally and more posterior inferotemporally. Over time, its diameter increases from 6.5 mm at birth to nearly 10 mm in adults, and its weight rises from 65 mg to over 220 mg. The refractive index ranges from 1.386 in the cortex to 1.06 in the nucleus. Accommodation reduces with age, from 15 diopters at birth to just 1 to 2 diopters by age 50. Color-wise, the lens is clear in infants and young adults. A yellow tinge appears after 35 years, progressing to amber in old age and gray in advanced nuclear sclerosis. Microscopically, the lens comprises the capsule epithelium and lens fibers. The capsule is a highly elastic acellular basement membrane. It is thickest at the anterior pole and is secreted by the underlying lens epithelium, while the posterior part is formed by the superficial lens fibers. Under light microscopy, the capsule appears PAS positive, and under electron microscopy, it shows lamellar organization with type IV collagen. The lens epithelium lies only anteriorly and contains 3 zones: a central resting zone with cuboidal cells, an intermediate elongating zone, and a germinal zone at the equator where mitotic figures are observed. New fibers arise here and elongate to form lens fibers that migrate and pack concentrically. Immature lens fibers are hexagonal, hydrated, and retain nuclei, while mature fibers lose their nuclei, become less hydrated, and interdigitate with neighboring fibers using gap junctions and ball and socket arrangements. The deeper the fiber lies, the older it is. This concentric addition creates zones: embryonic nucleus from the first 2 months of gestation, fetal nucleus from late gestation, infantile nucleus from birth to 25 years, and adult nucleus after 25 years. These fibers form Y-shaped sutures, erect anterior and inverted posterior, where the edges of fibers from opposing poles interdigitate. We've now covered the gross and microscopic anatomy of the lens, including its structure, zones, and developmental layering. In the next session, we'll continue with the detailed anatomy and function of the zonules of Zinn, explore key attachments like Weigert's ligament, and understand the anatomical spaces around the lens, such as the Canal of Hanover and Canal of Petit.